Bismillahirrahmanirrahim. I am Professor Asif Asghar from Pakistan, and I am presently working in a tertiary care hospital, Advanced International Hospital in capital city of Islamabad. One thing to point out right now is why a thoracic surgeon is getting a share or part of medical tourism. You see common diseases like renal transplant, liver transplant, orthopedic surgeries, neurosurgeries, and spinal surgery. These are the part of the medical tourism clan. But you see, if we notice that even in Pakistan, we are very short of chest surgeons, and there are in country like Pakistan, the socio-economic status the same as in all African countries. We are the developing countries. There are a lot of patients who are related to chest surgery, but there is no doctor available, and there is no general awareness where to refer these patients. So we will come gradually to the categories of patients, and at the end of my presentation I will be showing you some of my operated cases. Previous slide, please. Second slide. These are my two granddaughters, and see the excitement on their faces once they achieved their creativity. Next slide. Alhamdulillah, what I have achieved in this 14 years experience of thoracic surgery, I have served in multiple tertiary care army hospitals. I am a retired brigadier by profession, chest surgeon. So I served in army as chest surgeon for last 10 years. Now for the last 4 years after my retirement, I am working in a tertiary care hospital in Islamabad for the last 4 years. Up till now, I have trained 7 chest surgeons, and now they are working, alhamdulillah, as proper thoracic surgeon. I am examiner of Fellowship of Thoracic Surgery in Pakistan, and I have got a special training in single port VATS surgery from the icon surgeon Diego Gonzalez from Spain. I was pioneer of single port VATS in Pakistan since 2021, and I am also pioneer of prone esophageal mobilization for cancer since 2010. Next slide, please. This is a hospital where I am presently working, the Advanced International Hospital. This is located in Islamabad. Next slide. This is the few of the team members. Next slide. We have all the gadgetry, open MRI, CT scan, the dynamic X-ray units. Next slide. These are the banners. I have pictured them as such of mine related to the Advanced International Hospital. Next slide. These banners will be available with me if anybody out of you wants to take. They are most welcome. Now you can see here the list of the surgeries which we can perform. It is the video assisted thoracic surgery, which is basically a minimally invasive surgery from either 3 small cuts or a single 3 centimeter cut, the uniportal VATS. We do a lot of procedure with VATS these days. Chest wall reconstruction, my special area of interest. I will be showing you pictures of reconstruction of congenital deformities of chest later on. The airway surgery, tracheal surgery, in which the airway gets narrowed and it has to be repaired by resection and anastomosis. We'll show you the pictures of the patient. Upper GI surgery and neck surgery. You can see a very big thyroid going into the chest. We are also operating them successfully. And the special area is the pediatric thoracic surgery. This is one of the neglected fields in all over the world, and there are very few surgeons who are doing this pediatric thoracic surgeries. Next slide. This is our operation theater. Next slide. Now, what do we constitute of? definitely it's me, Chief of Thoracic Surgery. I have my assistant thoracic surgeon, Dr. Aisha, another registrar, Dr. Sahar Fikri. She has training in cardiac and general surgery, and two trained ward medical officers which are assisting in our post-op patients. Dr. Faisal, the Chief of Thoracic Anesthesia, two assistant anesthesiologists, 3 dedicated operation theater for us, and 7 ICU beds. And looking after all of our post-operative patient is our consultant of critical care, Dr. Shadli Manzoor. He is diplomat American board. Next slide. Now we have all the hardware required for a major chest surgery. You can see the list. All these things are employed once the patient is under anesthesia. And the instruments, we have these VATS towers, thoracotomy and sternotomy sets, VATS instruments, and flexible bronchoscopes for difficult intubations. Next slide. Besides chest surgery, our hospital also has the provision of a diplomat American board neurosurgeon, cardiac surgeon, and liver surgeon, also the colorectal and general surgeon. Next slide. Now you ask me to do any kind of thoracic surgery, I will be very happy to do it. But these are my special areas of interest. I am the pioneer of uniportal VATS, and for chronic empyema thoracis cases in which there is pus in the chest cavity, conventionally these were operated by a very big incision over the chest, but now we are doing this surgery using cameras and instruments by only 3.5 or 4 centimeter incision. I will show you the picture later on. VATS for myasthenia gravis. Okay. Now, next slide, please. We go to next slide. So, talking of the medical tourism, definitely I would like to operate the referred cases, the big surgeries requiring critical care in my country, in my hospital. But we should be having some bilateral terms of management. You see, if we have a well-equipped hospital to perform basic chest surgeries in Nigeria, I will be happy to perform such surgeries here. Advantage, the patient doesn't have to travel too much. Secondly, the surgeons and anesthesiologists who will be assisting me here, they will be passively trained in the same specialty, and that will be a great blessing for them. Otherwise, we are willing and we are offering for young Nigerian surgeons, if they want to get trained under my supervision in my hospital, they are most welcome to come over to me. And that will be a great thing for a general surgeon getting training in thoracic surgeon, coming back to his country and doing thoracic surgeries. Next slide. Now these are few pictures of what we are actually doing. Now see this patient on the left side. He has, previous slide please. His chest is depressed by birth. He's a software engineer and he was scared of getting surgery done. And he was operated by me. Alhamdulillah, see his chest fully recovered. The procedure osteochondroplasty after 3 months. This is his pictures. Next slide. This was a patient who had some growth in his X-ray of the chest on the right side, right lung. And the CT scan showed a grayish big mass which had to be removed. And this was removed using VATS, minimally access camera surgery. Next slide. Now this is the picture of the same mass which was visible on X-ray, the big rounded mass just over the heart. And this was removed using camera and instruments. And this is the in center, this is the patient recovered fully. Next slide. Now this is the doctor. He had some issues of infections and he was on ventilatory support, and after ventilator his airway got narrowed and he was not able to breathe comfortably. So next slide. You can see the 3D reconstruction of the lungs, and you can see the trachea from above. The airway, it is narrowed a lot. So this doctor was operated in neck, and this damaged and strictured portion of the airway was removed and resutured, and he recovered, alhamdulillah, fully. Next slide. This is a very common disease. If you see the left side of the lung, this is black, showing infection, and this is the disease of developing and underdeveloped country, very common bronchopleural fistula, usually because of tuberculosis. How we treat it successfully? Next slide. Now see this, we are taking a muscle flap and pushing it into this infected area, and this is the picture of the frail young boy who was operated, and he has, alhamdulillah, recovered fully. Next slide. This is the baby, 1.5 years old. This is the post-operative picture, but once he came to us, he was very, very sick. His chest was full of whitish fluid, a case of congenital chylothorax, which is a very rare disease. In my 14 years experience, I have seen the second patient with getting operated. In the biggest series on literature search was from China of only 6 cases. It is a very rare disease, and he was refused treatment by most of the hospital. So he came to us, and since I was very much interested in pediatric thoracic surgery, he was operated. And just by a single stitch on thoracotomy, his problem was solved. Next slide. You can see this white pledget used, and single stitch, and the leaking area was healed, and he recovered. Next slide. Sometimes the kids you operate, these patients become your friends. So this girl came from Dammam, Saudi Arabia. Her left lung was damaged because of a congenital cyst. She was very sick, having fever, coughing out blood. She was operated, and this was her picture when she was going home. Next slide. Now see this picture. This is single port VATS incision, and this is his second post-operative day. Initially, almost 10 to 15 years before, we used to give a very big cut, but here you see only a cut of 3 or 4 centimeters, and this is his second post-operative day, and the smile on his face means that he is having no pain. This is VATS decortication. Next slide. This is a very interesting case. This is the excised specimen. The patient had a cancer of the ribs, and this was a big mass. So it was almost the size of my hand, palm. This was removed, and what we are left with was a big defect in the chest wall. This had to be covered by something. So what was something? I will show you. Next slide. Now we created artificial ribs using bone cement. These are the ribs being prepared, and I am drilling a hole into those artificial ribs to fix them on the chest wall. Next slide. Now you see this defect is being covered by these artificial ribs of bone cement. Next slide. This is the patient. After 5 days of surgery, he is very comfortable. This is his extra chest. Next slide. This is the diagnostic procedure. A small lymph nodes along the airway, again being removed using VATS. Next slide. This is a very important operation, 6 hours duration, cancer of food pipe, esophageal surgery. This is how we drape the patient before surgery. Next slide. And these are the cuts the patient gets. After this surgery, the patient usually gets up and sits up as if nothing has happened because of these small cuts. And this is the surgery of 5 to 6 hours of duration. Very good results with minimally invasive procedures. Next slide. Thank you very much for your patient listening.